What's up, friends? And in this video, I want to talk about how to recruit caregivers for your home care agency. Cheers. Now, before I get into the video, I want to address something that I'm starting to notice on social media. It's a trend that's going around right now that is probably making you guys panic a little bit. Because you're in your house, you're not talking to anybody, scrolling through TikTok and Instagram, and you're trying to figure out, okay, is this gonna happen to me? People are stressed out, talking about CNAs are not getting paid enough, or home health aides are not paid enough. So there's a lot of complaining on TikTok. Personally, I'm not on TikTok. I'm not a fan of TikTok, to be honest. I'm always on top of these trends so I can deliver the most value to you guys. It's easy to get flaked out when you're seeing all this mass panic going on. You're gonna start to say to yourself, oh my goodness, I'm a home health aide, I'm a caregiver as well. This applies to me. But, does it though? Let me explain. Yes, caregivers are not paid enough. I totally agree. I think caregivers right now and into the future are gonna be paid a lot of money. I think we're gonna get into the era of caregivers being paid like $100,000, $150,000 a year. I truly believe that. I truly believe that we're going to start to see that trend in the next 5 to 10 years, where a home health aide or CNA is making as much as even $250,000. I'll get into the reason why I think the way I think. And yes, I know it sounds outrageous, but listen to this. Hear me out. All I do all day long is consume a lot of information. That's all I do. Got plenty of free time. Right now it's middle of the afternoon on Friday. I'm sitting in front of my favorite African restaurant. They got good food here, good drinks. So I can just chill here because I got time freedom. So what that means is I'm able to consume a lot more information that you guys are not able to consume. When I consume this information, I try to bring order to that information. So when I see these trends happening on TikTok of people crying that CNAs and caregivers are not getting paid enough, maybe I should just give up. No. You got the wrong information. You're operating on the wrong information. If caregivers are not paid enough, what does that mean? Well, I'll tell you what it means. It means a lot of good caregivers, especially the ones that are really, really good at what they do, they're just gonna go work for themselves. Do you know how easy it is to set up an LLC? Some of you that I've spoken to have told me that you already have your LLC. All you did was go to LegalZoom.com and just search for your state, signed up for an LLC for your state, and you got it already. You didn't have to go to a lawyer about that. You didn't have to consult anybody about that. A lot of you guys can do that. And all you're waiting for is that client. And if you get a client, you already know, okay, all I have to do is set up my business checking. I send them an invoice, they pay, and then I pay myself. A lot of you guys already know this stuff. It's common sense. There's gonna be a massive shift. I'm talking about the best of the best caregivers, home health aides, CNAs. They're gonna just start to go work for themselves. So which leaves these agencies dealing with people that are not really that good. They're not gonna make money, you see? Because now you're competing with the best that is working for themselves. We're not in the gig economy right now. This whole era of working for a company for 20 years, 15 years is gone. It's long gone. The travel nurses knew this game already. There's a reason why a traveling nurse makes more money than a nurse who's just stuck in one city. The traveling nurse knows which areas, which hospitals are popping. So for example, if you're a good nurse at Grady Hospital, you know you're like the best, but there's a hospital in New York that is paying nurses double what you're making, why won't you just live on the road? Rappers already do that. Copy what the rappers are doing. There are a lot of rappers, all they do, they put out a single, and then everybody knows about their single, and they just go on tour. They go from city to city to city to city to city, doing shows and collecting money. Traveling nurses already know how to do this stuff. This is not new information. Traveling nursing is going to explode, and a lot of nurses are going to get rich. You're going to start to see like a lot of nurses like balling out, even more than a lot of these other professions that are useless. And I'll explain to you why. Then I'll get into how to recruit, okay? I'll explain to you why that's going to happen. We are experiencing an aging population, kind of like what happened in Japan. The Japanese economy collapsed in the 90s. They were struggling, and we're seeing the same struggle right now. A lot of people are not having kids. Your social circle, they're not having kids. So what's happening is the population is getting older and older and older. Who's going to take care of these people? You're going to take care of those people. They're going to need people to take care of them. So this is where you come in now, because they're looking for the best. Because when somebody starts making good money, they don't want to compromise with quality. No, they want the best of the best. They want to live that sweet, soft life. So if you know you're the best, you got to come and say, listen, I am the best agency in town because I'm the hardest working. I deliver the best service on time, and I'm super organized. When I say I'm coming at 12 o'clock, I'm showing up at 12 o'clock on time. That's you. Trust me, there are people that will pay a fortune for that. I know if I was rich, if I was super rich, I would literally pay somebody the most. If they say I want $50,000 a month, I'm paying it. What? Because they're the best. That's what I want. I want the best. Because I don't want to compromise and struggle like that, especially after working so hard to earn a good living. Then I struggle. I don't want that. Nobody wants that. Once they start living a sweet, soft life, they don't want that. So in order for you to get the best caregivers, as you're building your agency up, it requires to recruit strategically. We've already talked about what a lot of people are doing right now, which is going to Indeed, these job descriptions for other job boards that are online, offline. Yeah, all that stuff works. Yeah, it works. But how do you know you're getting good quality caregivers? You don't know. The only way to know is to start with your network. Their favorite restaurants that you like to go to, favorite spots, chicken spot, where you like to get your chicken wings on a Saturday, you like to get your pizza, in your hood. Yeah, not in the hood, but in your neighborhood, I mean. Like me, right? This is my favorite African spot. I come here and I get my DB, I get my jollof rice. Come on, it's good stuff. Start there, because you're going to start to network with people that are looking for work, just like you are looking for opportunity. Your job is to be a magnet. In these places, it allows for you to be able to sit on a random day like this and just observe people. And you're going to start to see how people behave. And as people come to you, they're going to start volunteering information. They're going to start to tell you about how somebody lost their job as a CNA, but they're struggling right now. They don't know quite what to do. People will volunteer information, especially when you look like you got your life together, you dress sharp, and you stick out like a sore thumb. People are going to come to you and volunteer information, and you utilize that information in a good way. So somebody, maybe a granny that's always seeing you coming to that restaurant and greets you, and she's nice to you, she's very polite. She tells you about her granddaughter that just lost her job as a CNA. And you know her granddaughter. And you know her granddaughter is good. She graduated with flying colors and she's disciplined. Now you got somebody. That's who you need to start hiring. Before you go on Indeed, it's about who you know. We're now operating in a world of trust. Unless somebody trusts you, they'll never open up to you. Yeah, and you will never get the information that you need in order for you to level up. Because everything that's going to come to you in this business is going to come through relationships. Relationships that are built correctly, that are built on a foundation of trust, and I promise you, that's where the magic happens. My challenge to you guys is to start in your local area. You know the places that you like to hang out. I'm not talking about, the places that you go with your girlfriends to brunch. No, I'm not talking about those spots. No. Your grocery store, the local Publix, when you're checking out. Say hi to the lady that works over there. She knows somebody that is looking for. She's got stories. She's got wisdom. She's got the game. Be nice to her. Then she'll open up to you. And when she opens up to you, she'll tell you everything. She'll tell you who to trust, who not to trust. And you have really good, dedicated home health aides or CNAs through those relationships. I hope you got some value from this video. And if you are ready to take the next step in hiring caregivers, how to set up your business, how to get these high-paying clients, how to get good home caregivers, then let's talk. I got more strategies for you. I got plenty of strategies. So let's talk about it. Schedule time, link in the description of the video. Talk to you soon.